Hey, I wanted to just make an update to the previous video that I uploaded a few months back. I know there's not a lot of people following my situation and really keeping track on my well-being, but I mean, I did get a few emails just asking for how I was coping with everything and how I was doing. So for the 15 or 20 of you out there in the world that actually do watch my videos, thank you. And I will give an update on my progress since the last time that I uploaded that video. The last video I uploaded was more about Lyme disease in general and not about what I was going through in particular. So I'm going to kind of delve into that more because I wanted to kind of track my progress throughout this thing. So, there'd be more credibility to it if I did get better, that you could see me from point A to point B. I'm still more towards point A. I got sick around the beginning of February. Was when my symptoms really started kicking in. I lost about 30 to 40 pounds of muscle mass in just a few months. The weight flew right off, and I could not keep it on. It took me a while to get the diagnosis. I didn't get diagnosed with late-stage Lyme until the end of June. So that was about 5 or 6 months of just feeling like absolute shit until I got some type of answer. I had obviously it was through a naturopathic physician, so it's very controversial. I had a very low CD57 marker. The normal range is something between 200 and 300, I believe, and mine was a 16. And then I had some positive bands show up on the Western blot. So, anyone with Lyme will kind of know what that is, and to the rest, I know it sounds like a foreign language to you. So basically, I started treatment at the end of June, and I was taking about 80 different pills a day, and that's not an over-exaggeration, that's not a hyperbole. That's a straight fact. I counted. It was 80 pills a day, and they had to be all on different times. And it was like a full-time job just to take all these pills. And it was heavy antibiotics along with that. So I did that for about 3 months, and I just had no reaction to it. My symptoms weren't improving. Everything was just kind of staying in check. And even though my blood tests were coming back better, I didn't feel any better. I was really starting to question what was going on. I was starting to question the Lyme diagnosis. We have a family friend who was a nurse in oncology at Mayo Clinic. Mayo Clinic's supposed to be like the go-to medical hospital when you have a tough diagnosis, which seems to be my case. So she told me to go to Mayo. I mean, she hadn't seen me in a year. So when she came over and saw me, she saw how skinny I've gotten. I'm way too thin right now. And just, how pale and frail I am. And she was just horrified. And, she said, go to Mayo Clinic. I really think that this is cancer. And of course, that's what they originally thought. But she was looking, she's great, and she was looking through my tests and my papers, and she said there have been a lot of things that weren't ruled out yet. So I went to Mayo Clinic. I got, every single test run through. The day I got there, the doctors were convinced that this was either this was most likely cancer or some autoimmune disorder. And they were really stretching for Hodgkin's lymphoma. My lymph nodes were swollen, dramatic weight loss, the fatigue. It just seemed to fit the whole picture. Before I went to Mayo Clinic, my old doctor that was treating me said, "You can go to Mayo, but they will not find what's wrong with you. You are positive for Lyme, and they will never figure it out down at Mayo." I didn't believe her. I said, "Whatever. You're just trying to get some money out of us. Mayo's going to figure out what's wrong with me, and I'm going to be better." I went through a month of different tests at Mayo, and there were things that came up, like my body's just definitely shutting down on itself. There's no way, there's no denying that. But they could not find the cause of what was going on with me. I tested negative for all cancers, everything, all diseases, um, and you know, they started trying to diagnose me with chronic fatigue syndrome, which basically means we're tired, we don't know why, sorry. It's kind of like waving the white flag. And they wanted to run more tests, and I just pulled the plug. I mean, it became clear to me that, you know, the things that they were going to keep testing me for wouldn't even apply. It wouldn't even fit to what's going on with me. The cancers had been ruled out. So this was definitely, you know, late stage Lyme disease. And I had been referred to a clinic, in another clinic in Arizona called Envita. It's primarily an alternative cancer treatment center, but the doctor who runs the clinics had Lyme himself and treated himself and is now okay. So they get a lot of Lyme patients in as well. So I've started going there for treatment for Lyme disease. Now, what you have to understand is, I'm at Envita, and which seems like a great treatment center. I'm at Envita out of desperation. I don't know where else to go. You know, conventional medicine wants to diagnose me with chronic fatigue syndrome, which is fine, whatever. But you can't do that because I'm getting so much worse. I'm spiraling out of control. I'm watching myself basically die and just deteriorate. And you know, giving me a bottle of antidepressants to kind of boost my energy up isn't going to solve anything. And if I continue at the rate that I'm going, it's clear to anyone that I'm not going to be here in a year. I mean, this thing is this thing is basically killing me. You know, symptoms are ramping up, and it's getting, the weight keeps falling, and it's just getting really bad. And you know, I just started treatment with Envita last week, and you got to understand, you know, before this happened to me, I was in perfect health. I never got the cold, never got the flu growing up. So, you know, I'm going into this clinic, and I sit right next down to patients who are stage 4 cancer, who chemotherapy didn't work for them. And it's kind of surreal to see that, and to know that, you know, that, like, you know, I'm like kind of upon my last days, that like this could possibly be it for me at 21 years old, just coming on 22. And it's happened so fast because this is like 9 or 10 months in. So it's you know, your body kind of kicks into a survival instinct when you go through this, which is probably the only way I've been able to handle this emotionally without, you know, breaking down or freaking out, because I've just been in kind of like survival mode this entire time. But yeah, it was shocking to be in the same room as, you know, people who are also like literally dying, and you're getting a very similar treatment to them. Envita's extremely aggressive, and they rip you up, and they don't lie about what they're going to do to you. They're very honest that we will rip into you for 2 months. It's a 2-month treatment. I got to pour it in. If you can see the little bump. So they stick me with IVs for about 5 hours a day, 5 days a week. And as soon as they hook, I'm a week in now. As soon as they hook me up to the IVs, I get extremely sick. So I am having some type of reaction to the treatment, which is good and bad. I mean, you know, you don't want to feel any worse than you already do, but I kind of have to get through this situation. And I'm hoping that this works. I mean, I really do believe that this kind of is my last shot at this. I know that I can't continue to live like this. I'm not a suicidal person by any means, um, but I sit around every day and just watch myself suffer. The pain and the fatigue are getting to the points where it's really basically inhumane. Um, People with multiple sclerosis or with terrible diseases are nowhere near as in bad shape as I am right now physically. So it's a frightening thought to think that the next 2 months are going to determine the rest of my life. Will I get this thing in check and go on and get my life back and go on to work towards my goals and my aspirations? Or am I not going to, or is this not going to be effective, and I'm just going to be bedridden for the rest of my time here? And I mean, if that's the case, I don't want to just sit around in a road um, and watch myself die, so people can come to a hospital and gawk at me and lie to me about how I really look. People who see me see all the dramatic weight loss, and they try to lie to me that I look okay, but it's very apparent that I'm not as pretty as I used to be. So that's kind of my update on what's going on in the situation. I push forward because I also I want to provide an example for some of the people suffering with Lyme, so that they kind of have something to work off of. And Vita is very honest that they're not a cure-all for the disease. They don't have 100% thing down. So even if it does work for me, don't think that it's just going to work for every Lyme patient. That's really about it. Like I said, if you guys have anyone out there who comes across this thing, if you have any questions, just feel free to message me on my YouTube account. I'll do my best to get back to you, because we really are all in this together. If you want to know the clinic, it's in Vita Medical Center, and it's out here in Scottsdale, Arizona. And people from all over the world come out here for their cancer and Lyme treatments. So keep that in the back of your head if you want some nice weather, and to really treat your shit aggressively, instead of waiting around for years taking pills. This is going to be the biggest. This is going to be like the most ammunition you can use to get a hold of this fucking debilitating disease. So I'm going to stop rambling on. I'm going to stop recording. Like I said, I'll post back up in 2 months when my treatment's over, and either I'll be here or I'll be like upon my last days. So life is short, and don't take your time for granted, because you truly never know when something could happen to you, because this was just out of nowhere for me, and it just kicked me in the gut and just wouldn't let off. Okay, I'm done now. Thank you.